Yeah, now it has.
Fabulous. I am just going to share my screen. Please let me know whether you can see it.
Yep, that's all clear.
Fabulous. Okay, thank you very much for your time today, everybody. As you've just heard from Professor Dame Caroline Watkins, we're just going to give you an introduction to the programme. I'm Colette Miller, Programme Manager for the Insight Programme Northwest, presenting on behalf of the team today. And you will have some background and context to the Insight programme. You will see the official launch of round 2, and then we'll talk a little bit about how to apply, have some practical hints and tips, and then one of our Insight scholars from round 1 of recruitment, the lovely Kate Lynch, will be speaking about her experience on the programme so far. So the NIHR is funded by the Department of Health and Social Care, and they work in partnership with the NHS, universities, local government, other research funders, and patients in the public to deliver world-leading health and social care research, which seeks to improve people's health and well-being, but also to promote economic growth. So they have a number of different work streams. So they fund research, they involve people who are affected by research in that research, and they seek to attract and train people to undertake research that tackles complex issues to improve the delivery of health and social care services. So the Academy is the specific arm of the NIHR infrastructure, which is responsible for the development and coordination of academic training and career development. And they coordinate national research, they manage national competitive funding streams, and you may have heard of them, such as the pre-doctoral fellowship or the doctoral fellowships that are available. So their activities fall under the broad term of research capacity building. Now, research capacity building has been defined as the abilities, enhancing the abilities of individuals, organisations and systems to undertake and disseminate high quality research. Importantly, this has to be done efficiently and effectively as well. So the term research capacity describes the sum of capabilities of a person or an organisation to carry out this research. And the ultimate aim of any applied health and social care research is to increase the evidence base, inform practice, and improve outcomes for patients and service users. So to achieve this, we need a workforce that is equipped with knowledge and skills to undertake high quality research. And a number of factors can affect that research capacity. So that might mean lack of equipment, lack of resources, lack of training, lack of skills, lack of time. But why do we have this national important drive towards building research capacity? Well, essentially, it's because it's important that decisions about health and social care provision are based on the best available, current, valid, and relevant evidence. And this on the screen, you can see the most recent definition of evidence-based practice. And it suggests that essentially practitioners should be drawing on 4 sources of information. So their patients or service users' individual circumstances, their own personal expertise, some context-specific information from their service or setting, and also from research evidence. And it's been proven that professionals who utilise evidence in their practice and institutions with a positive research culture deliver services to a higher standard than those that don't. Now, people are motivated to undertake research for a number of different reasons, so hence the reason many of you are in this room today. And that might be because you had a good experience at undergraduate, you undertook a research project that you enjoyed, or it might be that you have had the opportunity to contribute to research delivery as part of your practice. Or it simply might be that you have been working in practice for a while and started to notice areas for improvement that you think actually, there's questions that can be asked here and things that can be done to make things better for everybody involved. So whilst we know that people are motivated for lots of different reasons, we also know that they need opportunities that are realistic and suitable for their experience and career stage. And despite acknowledging that that is all really important, research has shown that opportunities to engage in research are not equitably dispersed across health and social care professions. So moving into Insight, the Insight programme seeks to address that inequity through the collaborative delivery of 12 regional programmes to inspire people to engage in research and implement it in their practice. So the aim is that we will provide opportunities for newly qualified and early career healthcare, social work and public health professionals from a diverse group of professional backgrounds to take that first step in research, whether that be that they then go on to become involved in research delivery or whether they decide to take that academic career pathway. Here in the Insight Programme Northwest, it's a collaboration between the University of Central Lancashire, Manchester, Liverpool and Lancaster universities, and we have over 40 partner organisations who are dedicated to developing and delivering research that is relevant to the local, regional, national and global context. And we have on offer for round 2 up to 30 research master's student places for this coming year 2025, and there will be a call again in round 3. We have 30 studentships, so these include money to cover tuition fees and a stipend. I'll talk more about that shortly. There are full and part-time study routes available because we are very keen that if you wish to, an Insight Scholar is able to continue to develop their profession-specific skills whilst also learning about research. There are 6 master's courses available at 4 of the 4 universities, and on the right it might be a little bit small on your screen, but there is a list there of the number of opportunities available at each institution. You have the opportunity to undertake your dissertation with a leading researcher, and round 2 call opens tomorrow and will close on the 30th of April. In a little bit more detail, just so you're aware, the funding durations are capped at full-time must be completed within 12 months. If the part-time option is taken, then 24 months. Stipend amounts, again, are capped in line with national rates. Full-time, you will receive 20,780 for 1 year. That's tax-free. And then part-time, it would be paid pro rata 50-50 over the 2 years. Now, there are options with how to take that payment, either taking it direct, so you could either take a break from work to concentrate on study, you could use that payment to reduce your hours to allow you to study part-time, or you are able to take that as a salary contribution. So if you are already employed and you would like your employer to release you to study, then you are able to have that payment made directly to them to facilitate that release for study. Additional paid work, it's really important to make note of this. If you are studying full-time, it's expected that you would undertake no more than 1 day additional paid work. And again, part-time, no more than 3 days of additional paid work on top of a part-time master's study. And there is a really good reason for this. It's to enhance your chances of successful completion. If we know that combining too much study and work is not a recipe for success, shall we say. Now, eligibility criteria. Are you eligible? If you are a current or undergrad or postgrad student graduating before in the summer of 2025, then you are eligible for the programme. Similarly, if you graduated up to 5 years ago and have been in practice, then you are also eligible as an early career person. You must be working towards or have recently completed registration with one of the eligible approved regulatory bodies. There is an appendices that is attached to the slides and will be circulated afterwards. It's really important. You have to be a part of that. That's part of the NIHR Academy eligibility requirements. Now, the first 3 are about the eligibility for the Insight programme itself, but it's really important that you also meet the entry requirements of the chosen master's course that you wish to study. And if you are considering the salary contribution payment route for your stipend, you must have managerial support as a prerequisite to application. So you can see here that there are 6 courses available, 1 each at Lancaster, Liverpool and Newfoundland, and 3 at Manchester. And there is a diverse offer there, including some public health, to try and make sure that we're appealing to a variety of different healthcare professional backgrounds. The eligibility criteria for all of these courses is on our web pages, and then they link into the individual course pages at each institution as well for you to find out more about what the course entails. So in round one, we were really pleased to get a really good spread of diverse health and social care professionals. We had 28 scholars from 18 Insight Northwest partner organisations, and they are all currently undertaking their first steps in master's study. As you can see, over 2/3 went for the part-time option and over 83% went for the direct stipend payment route. And you'll be hearing more from Kate shortly about her experience so far. With regards to how we recruit, it is a single call to apply for the Insight programme. So applying for the funding of your fees and your stipend to the Insight programme, single call across all of our universities. You'll complete one application form and submit it to the Insight programme. We'll then have cross-HEI shortlisting and be inviting people to interview, and they will take place in June. Interviews will be held online, and then candidates will be notified of the outcome in the week commencing the 7th of July. The reason for this is that then gives you the time to undertake the individual application, registration and enrolment processes of the university for which you've chosen to study at, ready to be raring to go in October with your study. So here you'll just see some key important dates. Important to note that the applications close on the 30th of April, and we also have the preset interview dates on here as well. And we're also, throughout round 2 of recruitment, we are holding some drop-in sessions. So, you might go away today, start thinking and think, oh, I should have asked that question. If that is the case, please do just register for one of our drop-in sessions where you can meet a member of the team and just find out more. Similarly, if you are starting conversations with your employer about that direct salary contribution payment option and they have any questions, then there are some specific employer drop-ins as well. So please make them aware if they want to come and speak to a member of the team about what the Insight programme means for them. We do intend to publicise some course-specific drop-ins. So each of the course leads will be holding a drop-in about their specific course. So if you did want to learn more about the different master's programmes, these will be circulated in the same routes that we circulated the launch webinar and everything. So some hints and tips. Check you meet the eligibility criteria for both the Insight programme and for the master's course that you intend to apply for. Ensure that you've got line management support if you're planning to study part-time, particularly with this direct, the salary contribution option. These conversations can take a lot of time and may need require sign off from a number of different departments or people. So we do recommend that those conversations start early. Consider and have a think about who might be able to comment on your character, your academic ability and your suitability for research, because all of the universities, if you're successful, will require some references. And do spend some time on developing your personal statement. That's the first time we as a panel will meet you. So, you think about your reasons for undertaking a master's. What's your motivation? Have you had any relevant experience? Have you contributed to or delivered research? And what do you want to do with this? What are your goals? And then also do make a note of the set interview dates and make sure that you can negotiate time to prepare yourself for the interview and to attend the interview online. You may also wish to look at our chairs report, which is a summary of the recruitment to round 1, and that can be found in the frequently asked questions section of our website. Again, there is a QR code at the end of these slides for you to find the website, and that just has a summary of why people were and weren't successful. And again, more hints and tips about applying for the programme. And finally, from me, you can see here just an example of your potential earning ability with the Insight programme. So the first example at the top is just based on a monthly wage take-home wage for full-time employment based on a salary of just under £30,000, and assuming some different deductions for student loan, pension, etc. Then you can see full-time study with or without employment. So that is if you were to complete the master's within 12 months and to receive the full stipend over the 12-month period. It would be coming out at around just over £1,700 a month if you were to have the stipend alone. But if we then added 1 day of additional paid work, again, at that salary band of 30,000, then that could be potentially augmented up to £2,200. And then finally, the bottom option is part-time study plus employment, so completing within 24 months, and assuming that you would undertake 3 days of part-time paid employment, again at that same salary point. And again, you can see the take-home amount there. The examples are an illustration. Everybody's circumstances will be different, so please do make sure that you fully explore what the ramifications would be of undertaking study. And also, it's really important to make sure that you're adhering to tax laws when in receipt of a tax-free stipend as well. So that was a very brief whistle-stop tour of the Insight programme, and essentially we are planting the seeds of research capacity to nurture the growth of the region's health and social care professionals, and we look forward to receiving your applications. If you want more information, here are the links, and I am going to stop talking for a moment. Caroline, I can see you are poised and ready.
Yes, well, I wasn't sure whether you wanted to take some questions now, or do you want to leave it till after Kate has done her talk?
It's entirely up to you. How would the room like to do it? Has anyone a huge preference?
Anybody got any questions that they'd like to ask now? I can see Danny Fenton has a question. Do you want to ask that, Danny?
Yes, please. Thank you. I just wanted to ask, where you say that you would have to have a managerial agreement if you go to part-time, when that's agreed by the managers, would you say you should include that in your personal statement to clarify that you have? And additionally, if you was to do it part-time, is salary contribution the only option, or can it be paid direct if the employer allows you to amend your contract to only work part-time hours?
Yes, so definitely please include it in the personal statement. There is a checkbox on the application form to declare that you have line management support as well. And yes, you are right that you can do both ways. You can reduce your hours and work part-time and receive the stipend directly to you. That's entirely fine as well. It's just up to you which way you would like to do it.
Thank you very much.
It's just, if you have to understand, if you speak to your employer, they may pay you the full salary and just receive the stipend and let you reduce your hours, so you wouldn't miss out on pension contributions and those things. If you reduce your hours on your contract and you just take the stipend directly to yourself, then obviously you wouldn't have the same pension contributions.
Thank you for clarifying.
Okay, so Chen.
Yeah, just a quick question. So I just wanted to ask, when you guys say that you can't do more than 3 days of working, can I just ask, when you're doing a clinical or project, how many days do you require to be fully clinical? Just because my current role is slightly split. I'm doing 3 days of clinical and 2 days of medicines information. So I just wanted to know, do you have to be fully clinical during your research, or is it up to
No, it doesn't matter. Doesn't matter at all.
Okay.
So what we're trying to do is ensure that people aren't trying to do a full-time job and a part-time masters as well, because it's not doable. And
okay.
Yeah.
No, that's great. And just one other question. When it comes to choosing our research projects, have you guys already got some ideas in mind, or are we allowed to, suggest alternative projects?
Okay, so we asked the universities to put forward topics that the students can choose from. They may be quite broad, so that you could tailor something to your own particular interests. The main thing is that we told NIHR, and I guess we have to stick to this, that the research has to be aligned to an existing research programme that has been funded, so that there's some guarantee that what's done is robust and supported by experienced researchers.
That's great. Thank you so much.
Okay.
Sorry, Caroline, as well, just to be clear that no, it's not expected that people are working clinically. This is for health and social care and public health professionals, so it's not restricted to clinicians at all.
Sam?
Hi, I just wanted to ask really quickly whether we're still going to have the opportunity to apply for 2 options, just because the interview dates are on separate days. I wasn't quite sure how that would work in terms of, obviously, potentially if you didn't get one option, potentially being still able to go for that other option.
Yep. So yes, that's fine.
Yeah, essentially what happened in round 1 was that we interviewed with the panel of the first choice option, and we all agreed as a group to trust the instincts of individual panel members.
Okay, thank you.
Rachel?
Hi, Caroline. Just to clarify for my own mind, so I'm in a 3rd year undergraduate at the moment, so I don't currently have a job lined up. The interview process is going to be sort of alongside this application process, I think. So in terms of seeking managerial support when we're not yet employed, would you give us some guidance around that, or what the expectation from yourselves might be?
Yeah. Colette, do you want to answer that?
Yeah, no, that's great. You more than we're aware that it might be a time of flux for some people, but no, we would just recommend that when you're applying for roles, you suggest that at interview and talk to them about it. It may be that they're more than happy to support a reduced amount of time in the first couple of years to enable you to study, or it may be that they're looking for a full-time role. But again, we're more than happy to kind of speak to you on an individual basis about any questions that those employers might have about the programme.
Brilliant, that's fantastic, thanks.
Okay, Afonso?
Hi everyone. I just wanted to ask, for those that already have done a master's, does that really affect your application at all, or is it just normal? And also, is the application done all through your website? Thank you.
No, it doesn't affect the application. You're applying for a research master's, and yes, you have to apply through the website using the forms.
It's a Word document form that you can download off the website and then just email to Insight Northwest.
Thank you.
Okay, so Afonso, are you putting your hand down? Okay, so I can't see any more hands up now, so perhaps we could move on now to Kate, who's going to tell us about her experience thus far.
Hello, I'm Kate. I'm one of the specialist orthotists at Warrington Hospital, and I'm doing an MSc in Health and Care Research at UCLan through the first round of Insight Northwest funding. So firstly, for those of you who don't know what an orthotist is, it's a person who prescribes, adapts and fits any sorts of brace to anywhere on the body. So we do a lot of work in the background. We kind of appear on wards, fit a brace and disappear. We're not a very well-known profession, and this unknown, almost like secret agent style that we've got crosses over into our research as well. As any medical or healthcare professional knows, all of our practice should be dictated by evidence. The problem in orthotics, and I'm sure many other allied health professions, is that we just don't do research. We don't have time, we don't have the money, so we just don't do it. So if we go on to the next one, please. So in all honesty, I graduated university 2 years ago now, and I thought to myself, thank God I never have to write another research paper ever again. Fast forward a few months, and my boss, Eddie, introduced me to the idea of the NIHR's Allied Research Council Northwest Research Internship. And I loved the idea. It sounded really good, so I started the process of applying. I started in March last year, and I learned loads. I learned all of the stuff that I thought nobody wanted to tell me. Stuff like how to apply for ethics, how to decide what methods I want to use, and how do I actually analyse my data? And then I saw an email from one of the research team at my trust about this funded masters. And after many conversations about whether or not it was a good idea, I put my application in. So for someone who really didn't ever want to do research again, I quickly became very involved. And this was mainly because both of the NIHR programmes let me still run my clinic. I get to do the patient-facing part that I just love. So the next slide, please. How did I get other people on board? How did I get my manager to let me disappear for 2 days a week and do this? So the next step was getting my boss, and more importantly, my boss's boss, to agree to let me have these 2 days, protected time where I could do it. It went surprisingly well, to be honest. They were very receptive to the idea, and I just explained my stance on research, and that's this, that as clinicians and healthcare practitioners, and we do research all the time. We do it every day. We use innovative ideas and techniques to provide the best care for our patients in a way that just works for them. We might not formalize it. We don't write a big 20-page document and submit it for academic recognition, but it's the innovative and curious minds that fuel research. It's what furthers our practice, and it's what makes us strive to just be better. We do research every day just by caring for our patients and service users. They were very receptive to the idea after I got them on site, which was nice. And I'm very grateful for that. But I understand that this isn't the case for everyone. So my advice in that situation would be find the enablers. By this, I mean, we all have that one friend, you know, the one that like makes you stay out for just another drink or have just one more chocolate or go on, book that expensive holiday. Compassionately known as the enablers. Find the enablers in your workplace, the people who push you to just be better, the people who sit down and help you make sense of everything, who make you laugh when you might cry, who question you when you just want them to tell you that you're right. And I'm in a very fortunate position that my boss is a massive enabler, both in regard to making me better at my job and encouraging me to just have one more drink. These are the people that push us to ask the difficult and unanswerable questions sometimes, and they're the people that you want in your corner when it comes to applying for this kind of thing. It's such a beneficial and unique opportunity, and you want the right people around you to help you do it. So if we go on to the next page of will I fit in? So that group of the right people extends beyond the workplace. I'm from a tiny profession, as I've said, there's only about 500 orthotists in the UK. So whenever I go on to a course like this or enter a room, I spend half of my time explaining what an orthotist is. But it's so worth it. Through this master's, I've been ingrained into a group of like-minded professionals who are just interested in achieving the same goal. How do I make my field better? And it's genuinely inspiring. It's such a supportive environment. We throw around ideas, we discuss how to make each other's projects better. And one of the people on my course has already asked me to collaborate on a project with her in the future. So it's, you know, making connections. It's such a wonderful opportunity to get a better understanding of other professions and really collaborate and share those ideas. So my next question is, how's it been so far? And I've currently been on the MSc since September, and I am genuinely shocked at how quickly I've developed from absolutely terrified to a healthy level of nervousness and respect surrounding research. As I mentioned earlier, I did the ARC internship before this, which really helped me kickstart my first research project. But the growth I've had since starting the Masters it's been massive. It's helped me to submit an abstract to an international conference that I'm attending now in June, the International Society of Prosthetics and Orthotics World Congress in Stockholm, and I am showing my research there. Thanks, Colette. I'm 3 modules in, and I've already completed a full literature review, a research grant application, which I'm actually in the process of editing to apply for an actual £500,000 research grant. And I've completed ethics forms. Not only from a technical point of view, I've gained confidence, but my understanding of the different types of research has grown. I've always been very quantitative in that it's yes or no, that's the answer. But my respect for other types of research and my understanding of them, that there's more than one way to answer a question, it's been massive. I've become much braver and more confident in research, and I even told the consultant that he was wrong the other day. So so the next slide is, do I have time to do this? I'm not going to lie to you and tell you that this is the easiest thing I've ever done. But I think with some proper boundaries and timelines put in place, it's more than manageable. I'm a band 6 specialist orthotist, which means I see around 80 patients per clinic per week as an outpatient clinic, as well as covering trauma and medical wards, fracture clinic, emergency paediatric care, and a diabetic foot clinic. What I'm trying to say is, as most clinicians do, I have a very heavy clinical caseload. So it's been important for me to ensure that my time is protected. The programme, as you've already heard, covers your salary for 2 days a week part-time. So my suggestion would be to use it to its full potential. Because of this protected time, I've managed to carry out the programme reasonably easily so far, with all of my sanity still intact. I have one more slide before I say my thank yous, which is, where can I go from here? You know, we do these things because we want to grow. So what happens after that? So I walked in on my first day of the master's programme, and the tutor was talking about PhDs and professional doctorates and all sorts of scary things. My immediate response was, we haven't even started this one yet. But I must admit, 5 months in, and those possibilities and opportunities are looking very appealing. The thought of being able to make treatment and care better for patients is what's driven me through all of this. And I'll never be full academic, unfortunately, because I love seeing my patients too much. But I recently stumbled across the phrase clinical academic, and nothing's ever felt like it fits so perfectly. As clinicians and researchers, we put ourselves right in the middle of where the action happens and where those changes are made. And it'd be lovely to have a big long thesis and Dr. Lynch with my name and all that. And I know that those things will be possible for me because of programs like this. But for me, it's about making those changes that I know will benefit patients. But since I am here to talk about the programme rather than just about myself for 10 minutes, I think it would be wrong of me not to explain that there are so many opportunities that are available, especially with this course behind you. The NIHR have tons of funding streams and support for you in your clinical academic work. And I'm not going to pretend to be an expert on any of those, but it's important to note that they are available and that this is a really good place to start. So my next slide just says thank you. Thank you for letting me all chat for all this time. I hope I've helped you decide whether or not this is perfect for you. But if you do want to ask me any other questions, I'm happy to pass on my contact details or answer them. Finally, thank you to Colette for asking me to speak, and to the programme in general for just giving me the opportunity to do it all. It's been great so far.
Okay, great. Thank you very much for that, Kate.
That's okay.
So has anybody got any questions that they want to ask Kate?
Oh.
Has anybody, I think you've escaped from that one.
Oh no!
No, sorry, spoke too soon. So Sam, did you want to ask Kate something?
Sorry, I was a bit too slow to quick by hand. Kate, I just wanted to ask, because you're doing it part-time,
Yes.
have you managed to fit your days of study into like the 2 days, or have you found it like spilling much into like evening and weekends? I do appreciate there will be like a fluctuation in demand, you know, as the course goes, but how have you found that kind of side of things?
So because the days that the lectures are on change, my protected days also change with that. So it went from a Tuesday to a Thursday, back to a Tuesday, and then I think it's on a Wednesday in a little bit. So I've managed to, you get your timetable right at the start, so I've kind of worked around that. But I very easily fitted in to the 2 days. Yeah, I don't do very much in evenings and weekends. My husband's doing a PhD and he sits there typing away and I sit there reading my book. playing with the dog and watching telly. It's brilliant.
Fab. That's really good to hear. Thank you.
Jen.
Yeah, just building on that question that's just asked before. So can I just clarify? So are you doing the program that has a very set structured timetable, or because I think there's a lot of courses on offer and some of them have said that it's quite remote. So is that still the case?
Yeah, so I'm doing the health and care research masters at UCLan specifically. So I got that right then. That was good, wasn't it? So it's structured in that you have the day where you do your lectures. In the first semester, that was in person. In the second semester, it has been online. And then in your third semester, you choose options, and I've chose the statistics module because I'm a lunatic, which is in person. So it is a bit online, it is a bit in person, but it is the one I'm doing is very structured, yeah, and you know when you're doing things, which has been nice for me.
That's great. Thank you so much.
No problem.
Okay. So no more questions for Kate as such. Has anybody got any other questions? Thank you, Kate. That was brilliant.
No
Thank you
problem
so
at all.
much. Anybody else got any other questions? Oh, Rachel.
Hi.
Hiya. This was a more sort of general question. I'm just wondering, in terms of like our personal statements and structuring them, whether there's any kind of sort of NIH criteria that you'll be looking to, or something like the Vitae research framework that we might want to think about to sort of bring into our kind of our applications, basically.
Whilst
Well,
that's
let's
not a
not do-
prerequisite, it's not a prerequisite, but I am sure it would definitely be very useful to do.
Yeah. I mean, I think we're looking to see that, you know, that you can tell a good tale of why you want to do the course that you want to do, and how it's going to benefit you, you know, in terms of your career and the NHS or social care going forwards. So I think we just want to try and find people who are truly committed to doing it. Okay.
Just for anybody who isn't familiar with it, I'll just pop the Vitae Research and Development Framework link in the chat, because obviously it's something that people might not have heard of.
Yeah. Okay. So obviously, if there are things you want to ask us, then we had the QR code earlier so that you could find out how to contact us. So please do ask any questions. Don't mind at all, you know, whatever questions you have, however they feel, you know, things that you're worried about in doing the course, things that you'd like to confirm. We'll do our best. And even if you want to discuss, you know, what you would do with it afterwards if you got it, that's okay too. We're quite happy to talk through how this might fit with your career pathway and the options that you might have. Okay. Anything else you want to add, Colette, before we escape?
No,
Or let everyone escape?
That's everything summed up lovely.
Okay, well, thank you all for coming along today. Thank you, Colette, for updating us. Thank you, Kate, for talking to us. Thank everybody for asking lots of questions. That's always good. And yeah, please get in touch if you want any more information. Okay, have a great day.
Thank you.
All right, bye-bye. Thank you very much. Thank you. Bye-bye.